Hello, my name is Kendyl Pierson, and my SURF presentation is Finding the Most Effective Treatment Method of Myofascial Trigger Points, a Systematic Review. Now, myofascial trigger points probably sound a little scary, but don't worry, you've probably had tons of them. They are more commonly known as muscle knots and are often simply caused by strenuous activity and found in the major muscles. This is shown on a fibrous level in Figure 2 on the poster. The muscle knots are the red nodules found in the regular muscle and clearly show a disturbance that could have an effect on activity. Myofascial trigger points, or MTrPs, affect at least 9 million people in the United States. MTrPs can affect anyone, but especially those who consistently play sports or participate in strenuous exercise. MTrPs reduce muscle elasticity, they cause weakness, and produce pain in response to direct pressure. This can put a damper on training. But there is hope. One good thing about these muscle knots being so common is that there have been multiple methods developed to treat them. This review looked over dry needling, kinesio taping, laser therapy, ischemic compression, and ultrasound imaging as methods for treating MTrPs. To give a short summary of each method, I will begin with dry needling. Dry needling is a method that one has to have a certification in and uses needles to activate a trigger in specific points in the muscle to loosen them. This is shown in Figure 4 of the poster. Unlike acupuncture, the needle is inserted into the muscle for only a short time, then moved around by the therapist in order to induce a spasm in the muscle to release tension, then instantly removed and not left in the patient. Kinesio taping is a treatment of using elastic and ventilated tape to continue the effect of manual therapy or massage in the hours after the treatment. This can go with or against the grain of the muscle. This is shown in Figure 1 on the poster. Laser therapy causes an increase in cell proliferation and motility. Ischemic compression is temporary blockage of blood flow to the muscle to reduce swelling, which is followed by rapid inflow of oxygenated blood upon release. This can be done with sleeves, socks, or even machines. The methods used for the systematic review began with 211 identified records through database research, then duplicates were removed, then 51 records were screened, then 20 full-text articles were assessed for eligibility, and finally 8 total studies were used in the final analysis. This is shown on Figure 3 of my poster. The systematic review analyzed 8 studies that compared these different methods against one another in order to decide which would be the best for any given situation. To give a couple examples of the different studies analyzed, a statistical analysis compared kinesio taping to compression on 60 subjects aged 18 to 35 and concluded that kinesio taping worked better in that case. A different study observed laser therapy versus dry needling in 21 female subjects with active MTrPs, and results demonstrated a significant decrease in pain with both methods. Other studies analyzed resulted in one method surpassing the other in that specific situation, but multiple studies contradicted each other. The findings of the review suggest that dry needling, compression, kinesio taping, ultrasound, and laser therapy are all effective methods of treatment for myofascial trigger points. The debate for which is the most effective depends on what's most important to the patient in terms of time spent, sessions required, and pain reduction to that specific case. Learning these results after my study, I decided the public health indications and recommendations are that the therapeutic decision should ultimately be left up to the patient and the medical professional they have chosen to work with. I personally have had ultrasound, compression, taping, and dry needling performed on me in my personal experience. I would say I prefer compression for mild knots and dry needling for when they get more excessive. But my preference is most likely very different than even other athletes in my college, let alone my community. Each method has its strengths and drawbacks, but ultimately it should be left up to the patient to decide what is best for them based on the most information possible. I would like to say thank you to Gerald Schaefer and the Health Sciences Department for helping me to make this presentation possible. Thank you for watching and have a great day.